Good morning.
Good morning.
Well, everybody sounds very lively this morning. What is today, Tuesday?
Yes.
Okay, so we're well on our way for this week. You sound so lively, we can get going. My name is William Washington, and I'm from Meharry Medical College. So welcome. This is the first Nashville Public Health Learning Collaborative kickoff session for 2013. This collaborative consists of 3 academic institutions. I think you know who we are. One is Meharry Medical College, the other is Tennessee State University, and Vanderbilt. The purpose of this collaborative is to contribute in the workforce development goals of our health department in meeting established public health workforce health competencies. Again, with me today are 3 people from the institutions, and they are all directors of public health program. Today's program is called Mapping a Vision of Your Public Health Career, Maximizing Return on Investment. And the participants are Dr. Cooper, again, Dr. Canu, and myself. Dr. Leah Alexander is not here today. She is having surgery. So I'm going to start off by, again, introducing the speakers. Dr. Canu will be talking about some case studies that he will be using, and Dr. Cooper will lead the discussion of those case studies. Dr. Canu.
Good morning again, everyone.
Good morning.
It's very good to be here. You always see faces that you haven't seen in a while, and that in itself is very, very thrilling. We are going to begin this conversation today by talking about someone who we think can really represent what public health is all about. So the case study, like Dr. Washington told you, is about how we develop our public health careers. And so we will use this person to demonstrate the conversation that is to come. You know, we all have our own role models. Every now and then, somebody thinks about, how did I start in life? And he was this person who actually inspired me. The person we are talking about today has a lot of that inspiration from family members, interestingly. His grandparents are people who were missionaries, going to as far away places as Africa and Central Africa. Very, very much obsessed with the idea of helping people. And so he realized at the time that if I'm going to follow this path, I have to be trained first of all. And so decided to go to medical school, pre-med, with that vision. And at the time, there was somebody who was even closer to this person's life, who was an uncle. And this uncle was actually doing a lot of work, training people in places that not all of us can be. There's actually a book talking about where there is no medical doctors. So what this guy was doing was training those medics so that they can actually create an impact in those communities where you don't always find doctors. So the person we are talking about today took a lot of inspiration from this uncle. Studied medicine, of course, and realized very quickly that it was important for him to do that alongside with some training in public health. And he chose epidemiology as his own concentration, which we know, some of us know, if not all of us, that it's actually the bedrock of this discipline. It's very important that you get that background if you will do some sound work. So he enrolled, and when he finished that, he actually applied on the advice of one of his mentors to take an elective at the CDC. He did that, but he was also advised to look at the Epidemic Intelligence Service, which I must add is a very prestigious and very highly competitive program. You essentially train as a disease detective. And so he applied for that as well and was selected. We'll get back to that. So he completed medical school and his residency, of course, to Wisconsin in internal medicine, and then joined the service. And immediately after that, he was assigned to the Division of Vector-Borne Infectious Diseases, a wonderful opportunity to actually put to practice what he had been trained. And very quickly, he saw himself being sent to various places within the country and outside of the country as well. Some of these places, as you can see, include Missouri, where he was there to look at a possible outbreak of Lyme disease, and other places as far away as Saipan. Of course, all of this provided wonderful experience for this person. And that is just giving you a few examples. This point in his life is very, very important, because as he finished the intelligence service training, he started to actually feel a very qualified person to do this work. But he wasn't quite sure at the time whether he was going to focus on medicine that focuses on treating individuals, or look at what we normally refer to as population medicine. So for some time, he decided to apply for a fellowship to add to his training on infectious diseases. He was accepted, he was selected. But before that, and I really need to emphasize this, he decided to spend a year at the Chicago Department of Public Health. And I say this is a turning point because he saw first time how useful his skills would be in a setting like that, and how much the institution could actually use his skills. And that was very important because he appreciated his training and what he could actually offer beyond just treating an individual at a time, but reaching many more people at the same time. So after the fellowship, he decided to go back to the same department where he was for some time. And he spent the next 15 years there. And while he was there, he had a lot of accomplishments. I give you a few there. He was part of a team that was able to provide a very robust response during 9/11 and all the anthrax attacks. He was also able to build a very formidable team in terms of improving the capacity of the department, as well as addressing a raging, well, maybe raging is exaggeration, but a very big surge of tuberculosis at the time. So all of this and many more that are not outlined here were some of the accomplishments that he was able to make within the time he was there. One of the things we will learn in public health is that it has an expanding agenda. You think you are finishing one thing, and something else is already waiting for you. And so as you do this, as you accomplish one thing after the other, people are going to keep watching you, especially when you demonstrate all of those skills that you have. And they will call on you from time to time to actually continue to do more. So while he was there, with all of the skills and all of the team effort that he was leading, he was actually appointed as Deputy Commissioner for Epidemiology and Disease Control, and was also later named the Acting Public Health Commissioner in Chicago. Another characteristic of public health, some of us will know, is that it is very inherently political. And that is important because every now and then you have to meander through those, that kind of a landscape. So after some time, he had his own challenges and just thought it's time to explore other options. And he did explore those options that took him to his current position. In the current positions, I like to quote this. He says, "We strive," meaning we as a team, strive as a team to improve the health of the public in various ways. He did emphasize that along the way, and I'm sure that is true for all of us here, that a lot of opportunities may become available along the way, but you have to make a decision about which of those that you'll pursue. He chose to stay where he is. And he says that in public health, it is some way a leader, everyone in public health is in some way a leader. And I think that is a really very important quote, because sometimes, you are within your own small confinement and you're not aware of how much a public health role that you are playing. And that he insists that it must be the emphasis or the focus of every public health institution to train leaders. You may not have the title that you are actually expecting, but indeed you are a leader. And who is that person we've been talking about? I'm sure this is somebody that you're very much familiar with. And it's your director who became the director of this department in July 2007. So before I hand it over, let's just recap some of the things that I've said very quickly. What have we learned from what we've heard? The desire to help others is something that has to be innate in all of us if you're actually interested in public health. And we saw that in this person's case in terms of what he took from his family. The beginning may not be a core public health focus. We saw that. This guy was trained as a clinician, but realized that he can actually combine this with a much bigger focus. And that was what we saw. Field experience, and I must add, just adding to your skills. It's a very important thing. He was trained in several things, because that is the thing that is going to make you a very effective leader or public health person. The end may be unknown. You start small, who knows where it's going to end. And of course, you have to like what you do. And that is the only thing that will keep you going. If it is all about a paycheck, sometimes that motivation may not be as strong. But I think the paycheck and, of course, the desire to do what you want to do will take you a long distance. At this point, I'm going to hand you over to my colleague, Dr. Cooper, to give the presentation.
Well, good morning. It's really great to be here. I see some familiar faces from our previous sessions and then some new faces. To give us a feeling for who we have here today, I know we have some people from Family, Infants, and Youth, from Health Services Administration, from FNA, from Environmental Health. What other groups are represented here today so we can know sort of how to gauge our time together? Anybody else is here?
Prevention and wellness with the health department.
Prevention and wellness?
Lactation specialist from the South Nutrition Center.
Great, great. I know we have some from WIC. Yeah?
Early intervention specialist with STD.
Great. Epidemiology. Okay. Great. Well, that gives us a broad. And the nice thing is I also see, based at least on your evidence of life experience, a range of career experiences here, sort of time spent in public health and time spent living. On the far end of number of years living, and we have the opportunity today to think about sort of public health as a career. So Dr. Cont talked a little bit about, we do get paid to do our jobs often, and that's important, and those kind of things. But it's also thinking about how can you make an investment in what you do and what you bring to work every day so that you can enjoy what you do, but also so you can help people to the maximum ability. So that's what we talk about, sort of the investments that you bring. So I want to tell you a story. I happened to be walking down Charlotte the other day, and I ran across two bricklayers. I said, tell me a little bit about what you're up to. And the first bricklayer said, I'm laying bricks for this building that we're building over on Charlotte Avenue. That was great. It's a nice thing. This person came to work and did those duties. The second person said, I'm helping to build a building that will be used to protect the health and well-being of every single person in Nashville. That's what we strive for you to think about, is that when you come to work, whether you're a research analyst or you're a frontline clerk, whether you're a program manager, that what you do can make a difference for everybody in our community. If you help somebody, when you walk in that door there by the birth certificate office and somebody looks really lost, and you help them find what they need, and you connect them with a vital public health service. You get them to the STD clinic, or you get them to the nutrition clinic, or you connect them to the outpatient WIC services. You've made a difference for those people. And that's what public health is about. That's what drew us here. So what we're going to do as we think about how do you map a vision for your career in public health is really three major areas. How do you discern your passion? How do you determine the path that you might take to realize that passion? And how specifically, once you've decided where you're going on your journey, and as we found from Dr. Paul's experience, we may not know exactly where we're heading with that, but we might have a general direction. What are some of the contributions that you can define for that? There's going to be, I would like to have just a moment of personal self-disclosure, and I will tell you that I abhor personal self-disclosure. Unfortunately, however, so like at church when we break into small groups, I run out and find some medical emergency to tend to. I'm the master of, oh, it looks like somebody's paging me with something important. But to get through this experience today, there's going to be a couple of minutes where I'll have you talk with each other and do those kind of things so you can begin to get a feeling for what that feels like to describe your passion. So let's talk about the first thing. Your passion for your career in public health often arises from experiences that you've had. You might have had an educational experience where a mentor or a teacher who meant a lot to you sort of exposed you to something that was important. It might be professional activities that you engaged in. If you were involved as a nurse or a manager or a delivery of care in some way, and you came across people who had troubles with breastfeeding and really needed help to access services, or you had people with other things that might have been an important thing. For Dr. Paul, a role model, people in his family who had made a difference in public health really shaped how he pursued what he did. It might be from personal experience. We often find that people, particularly in public health, have experienced for a family member either an illness or an experience or an engagement with something that was really profoundly life-changing for them. And it's sort of the central defining point of their career. Well, what's really useful is when that defining point and that passion guides their activities. Why do I do what I do? I'm an epidemiologist and a pediatrician. And my passion for doing what I do, in the research work that I do, I look at evaluating the unintended consequences of health policies for vulnerable kids, particularly kids served by TennCare. I look at medication issues, medication safety issues. That arose from a patient that I took care of when I was a second-year resident at Cincinnati Children's Hospital. It was 2 days before Christmas. And I was covering the major resuscitation unit in the emergency department, and the EMS squad called in a baby, a 2-month-old baby who was in full cardiac arrest. The baby came in, we started our resuscitation measures, and as you would do in a baby of that age, we checked a blood glucose, and it was less than 10. Normal would be more in a much higher level than that. So we started responding to that, but also checked that to say something's not right with that. Came back again, less than 10. And unfortunately, despite everything we did, despite throwing every life-saving measure we could, that baby died. The story, as we began to collect the history, was the mother, who lived 3 blocks from the Cincinnati Children's Hospital, had run out of money and had gone out to try to find money for her family. Left the baby in the care of the 8-year-old with no formula. So the 8-year-old was giving the baby water for 2 days, and the baby, within sight of one of the largest children's hospitals in the world, died. That had a profound effect on me. Every day I come to work, I want to do something to prevent those things from happening. That's my passion. I actually have on my desk a circle, and we're going to do this with Post-it notes in a little bit, a circle that says vulnerable children. And I think before I go home, what did I do today to make a difference for that? Well, that's what you can do in your careers depending on what your passion is. So what were the common threads that fed through Dr. Paul's case presentation? Tell me, what did you remember from that, from Dr. Connor's really excellent description of that? What struck you?
He had a role model.
Yeah, he had a role model, and so you can see he's heading that way to say, I want to make a difference for people too. What else? Did he have a linear route where he went straight through? He said, I'm going to be the director of one of the best health departments in the world, which he is now. right? No, it was like, well, maybe I might do infectious diseases, or I want to go do these things. That's fine. Your path may not always go exactly like you intended to. Any other observations? So we want to also add in, because it turns out that the Metro Charter only allows there to be one director of the health department. So we're not asking you all to become the director of the health department. So we want to draw some we've collected other case studies of real live people who've been here. We've gotten their permission. We've also sort of changed the circumstances to keep them anonymous. But we use these as examples. Some of them may not be so anonymous if you figure it out. But we tried our best. Maybe what I meant to say was recognize motherhood. The first case study is someone who was a public health professional involved in a health promotion program for a completely different topic than fatherhood. However, this individual recognized that one of the things that was happening in the youth and the families that were impacted by this program was challenges in fatherhood. So he set about to make a difference for that, and he pursued opportunities and programs just that were assigned to him in his regular duties, began to take other roles in programs that had to do with fatherhood so that he could make a difference. And in his role as a health department employee is really making a huge difference in our community for issues related to fatherhood. That's exactly what I'm talking about. So, we're going to do skills building during our time today. And the first thing I want you to do is just take a couple of minutes to identify an experience that has affected your career. What's something that has impacted you? You work at a health department for some reason. So what is that? What is that experience? And reflect on sort of how you might use that to help define your passion. Did I know on December 23rd, 1994, that was actually 92, the direction I was heading? Well, no. I knew that profoundly affected me, and I never wanted that to happen again. But I didn't know that I was going to get an MPH and work with the MPH program and be standing here talking with you, right? But I did know that helped define a critical moment for me. So if you're early in your career and you don't have this laser precise vision for that, that's fine. But just think about an experience that you've had. And then think about a particularly useful passion is where you can make a difference in what you do. Something that's exciting, and come to work every day. If you can't think of a particular crystallizing moment or an experience, just think about why you took this job. What brought you to public health? So just take 1 or 2 minutes just to sort of, if you need to jot it down on the pads of paper that are in front of you at your table, you can do that. But just think about that for just a minute, and we'll keep moving. This will be sort of an interactive skills building. Okay. Is anyone willing to share with us their experience? Yes?
My experience basically stems from a home visit that I come from Detroit Urban League with. And I work for MSU Extension as a breastfeeding peer counselor. And this was my first job as breastfeeding. Me and my husband have 3 children, and we breastfed all 3 of them. But I wasn't sure that this was the thing that I wanted to do until I had this experience. We went on a home visit. A mom called, and she was engorged, and she was crying. It was painful. She was in tears. So me and my colleagues, we almost felt like the Ghostbusters. You know, Jerry grabbed the pump, I had the cabbage, and we went to the mom's house, and sure enough, she was in so much distress. She couldn't nurse the baby, and her breasts were like boom, boom. Okay?
Let's keep this family friendly.
And you know, we just went in and we went to work on her. And to make a long story short, after we finished, after we were done, And we gave this mom such relief, and the expression on her face, you know, that we came and we helped her, we serviced her, you know, it was priceless, because now, you know, she was able to continue to breastfeed her baby, and that was just a very, very empowering moment for me to know that, you know, wow, I got some skills where I do make a difference, you know, to the moms and what they're going through, to make them have, you know, a great breastfeeding experience.
We could stop there. That's sort of like a passion skit, isn't it? You know, it's like, you know, I feel like it's one of those infomercials, like, you know, I spin this thing around and I instantly get salad. So that was some good stuff right there. I really have nothing to add. So what I want you to do is take the Post-it notes. Each of you has a Post-it note pad. So each of you take a single Post-it note. Now, this exercise may seem a little silly to you, but I tell you that I use it with all of our faculty. We have about 250 faculty in the Department of Pediatrics, and I work with an Office for Faculty Development there. We've gone through this exercise, and it makes a huge difference to be able to, when you see Dr. Paul in the hall, or you talk to somebody who says, well, I understand you work at the health department, what do you do? If you can rattle off a sentence that says why you do what you do and how you think it's going to make a difference, I can't underestimate what a profound effect that has when you can engage people on that. So it's sort of like Mad Libs, if you ever did Mad Libs as a kid. If you'll fill in the blanks here and just say, my vision for my public health career comes from my experience of running across mothers who were in distress early on in the breastfeeding process. I'd like to pursue a career in public health that will allow me to help those mothers or fix the problem that your significant experience demonstrates. Fatherhood, people impacted by important communicable diseases, babies who are adversely affected by health policies. By using my skills, my people skills as a clerk, my management skills to lead a team of lactation consultants. Okay? So write these sentences out. My vision comes from my experience. I'd like to pursue a career that will allow me to blank by using blank. And I encourage you, if you're willing, to use this Post-it note form, because you can take this back and stick it on your computer. All right? You can put it you could put it on your rearview mirror, but not obstructing your vision, in your car to remind you. And it will serve as a reminder for why you come to work. Because some days, work sucks. And it's really hard, and it's tiring, and you do something. Or for me, I get a grant rejected, and another grant rejected, and a paper rejected, and it's like, golly. And then I remember why I did it when I think back to that baby. So now, your next skills building session, skills building number 2, is to vet your passion. What I want you to do, all you have to do in this is take your Post-it note, read it to the person next to you, and say, based on what you know about me, I think you all know each other well enough to know you know what her passion is, right? It's going to capture what she is. But say, does this capture what you see in me? Do you see me doing this every day? What suggestions do you have about sort of what that might look like? If you don't know the person and you don't work with them, that's okay. Just sort of, you can just briefly describe kind of what you do and why that led you to that. But just I want you to sort of pair off with the people that are next to you and share your vision Post-it note quickly, and then we'll reconvene. Okay? Go ahead. All right, this is a talkative group. I like that. And walking around and listening to your conversations, they're really substantive. And you know what else you're doing is you're helping each other. I heard one person say, you know, I'm really having trouble seeing where I might sort of go to this next step. And another person said, well, you know, there's a lot of trainings here. You can go to the TPHA meeting and all these things. Already ideas coming across to sort of help you think about how you might map out your steps. I heard several of you describe children that you'd run across, your own experiences. Does anybody have any observations you want to share with the rest of the group from either your vision statement, or you can tattle on someone else's for their particularly compelling vision statement? This group back here, you all were having a nice conversation. Would one of you be willing to share your statement?
Okay, I'll share my statement. My vision comes from my experience with working with pregnant moms and dads. I like to pursue a career in public health that will allow me to empower my patients as well as normalize the birth experience by using love, further education, and building a community that will encourage it.
Wow. So if you come to work every day and you do something to move that forward, you'll make a huge difference. That's great. You know, it might be as simple as helping the mom. So what you can do to help her vision is when you see the pregnant moms coming in looking for the prenatal class or coming to the incredible baby shower, help them get there. For heaven's sakes, carry their bags and their baby seat for them. It is hard to get all that stuff there. And when you've got a newborn baby, you are always late. So they are feeling rushed and stressed, no matter what. You know, you're leaking, you can't get the baby fed, then the baby pees all over everything, and then you drop something and it's raining and you can't get everything in the car, and then you actually leave the husband at home, you know, the father's not there. So there's a lot of things that happen. So helping those moms every day can be really helpful, all right? So now, no educational experience would be useful without applied skills learning. This is your homework. I want you to take your passion, your vision statement, and I want you to vet that by someone else in your professional life. That might be your supervisor. That might be other colleagues within your division or your branch or your section. It might be somebody that's important to you in your life. But within a time frame that you can determine, I want you to sit down and share that Post-it note with your person. Share that and say, does this capture what you see in me? What suggestions do you have? And the person, well, I want you to ask somebody that has a little more experience than you and say, what did you learn from your experiences when you were at my stage in your career that will help me? Okay, so that's your homework, is to take this Post-it note and share it with somebody else and get their thoughts. Okay, now, let's do a little reality check. We've talked in very warm and fuzzy terms about how we're here to help people, right? And we're about this. That is true. There's a spectrum of how you might view your public health career. It might be a job because you need to put food on the table and tires on the car and get the oil changed. It might be a vocation, so much so that you say, Dr. Paul, I am so happy to help these mothers who are distressed with breastfeeding. You don't have to pay me. I'll just come and do it for free, all right? There's a whole range of stuff. And in your career, you're going to be up and down on that spectrum. That's fine. We are not here to judge you if you get paid to do your job. No one's going to do that. If you come to work every day and it's just kind of a job and it's a way to move things through and get your kids raised in a nice community, that's okay. However, can you make a difference for the clients that you serve and it still be a job? Well, heck yeah. The practical things that we've talked about. The other thing I want you to reflect on is that depending on where you are along that spectrum, were you to move one notch closer to sort of like, this is a passion for me, would it make your work slightly more enjoyable? If you felt that what you were doing is important, would that help out? So I just want you to reflect on that. But it's an important reality check to say, we're talking about this, but we're not here to judge you for where you are on the spectrum. We just want everybody to think about it as a journey and understand where that is. Okay? So we've talked about your passion, what it is that brings you to work every day. Children you've run across, experiences you've had as a public health person or as an individual. And so now let's think about what your path is. Now, ideally, if you're a passionate breastfeeding advocate, you would probably want to do something where you can help people with breastfeeding. That makes perfect sense. So it sounds like you have a nice alignment with what you do. If you are really passionate about preventing the sequelae of sexually transmitted diseases, working in the STD division would make perfect sense. If you want to help children or you're into fatherhood, all those things are places where you might align that. What direction do you need to do to make a difference in that area of your passion? Now, this might be, your latitude may not be all that great. It turns out that government health departments, the people are not throwing millions and gazillions of dollars at them and saying, create a whole bunch of new positions and give people a chance to just do exactly what they want to do, right? That's fine. You can still, within your work realm, if you are the clerk in the tuberculosis clinic and your passion is giving people from different cultures and languages access to appropriate services, you can still make a huge difference in that. It doesn't require you to move to the language section. It just requires you to take what you're interested in. If you have passions in social media and you are the queen of Facebook or Twitter or Instagram, you might help the incredible baby shower by saying, you know what, you're doing a terrible job, Dr. Kim. There's no Instagram pictures out there. Get with it, right? You got to get on this and help her, right? Post some pictures on Instagram. Link to it on your Facebook page. So you can make a difference, whatever your passion is, within your areas of responsibility. Dr. Kim's running out to get her camera. So that I used to call it the world's most magnificent, amazing, bountiful baby shower until I figured out what it was exactly called. So, and it is that, you know. But anyway, so thinking about determining your path. So let's think about another case study. So this is a case study of a newly minted MPH graduate who joined the health department, and this person identified a passion for health issues facing youth. In the position she started in, there were some opportunities to interact with youth, but not a lot. It wasn't a primary part of her responsibilities. However, she worked with her supervisor to say, this is where I see myself going. She didn't have a Post-it note, but that's what she articulated. All right? So she worked with the supervisor, and they together said, okay, over the course of the next 4 or 5 years, here's the types of skills you're going to need to make a difference in this area. All right? We want you to understand, how do you market public health programs to engage youth? So I'm going to make part of your work assignment. We'll work together to make that so that these new programs we're rolling out, you can help us think about marketing them. We want to help you understand, how do you engage youth? Now that I'm raising teenagers, I understand it is we talk about language barriers. There's an entire language and a way of engaging and talking with youth that's not threatening and will engage them in a way that will allow them to make contributions. So the person then was sort of part of her responsibilities and her work were working with youth on the Youth Advisory Board. She then began to work with some of those youth and also at the department level on a policy for youth tobacco prevention, right? So that's a great opportunity to influence policy. She knows the language, she has the marketing skills. She knows how to say, hey, can you help me put this policy together by getting the youth to help with some of the language that would be useful. And then she was helping to write grants for a new tobacco prevention program. Well, that's a beautiful alignment of a path. It required a committed person, right? But also required a pretty smart supervisor who was willing to say, let's work within your job to make all this work. And this person really made a difference for youth tobacco prevention through this pathway. She didn't come through the door saying, this is where I'm going to be heading. She did have a path that was guided by her passion and a set of skills that were needed to be developed. Another case study is someone who had already been at the health department but wanted to grow his or her skills. So this person said, you know, I really see that a lot of what I do, I'm a research analyst, but a lot of what I do requires analytic and writing skills. So this person talked to their supervisor about a topic and an ability to develop analytic and writing skills, and the supervisor allocated time to develop a special report that was really useful. This person actually recognized their passion to further their education and pursued an additional degree. Now, there's options that you have that may not be available to everyone in every single position in the health department, but there is the potential to talk with your supervisor about flex time, about weekend degree options, about evening hours. Are there ways that you can do that in your current position? If the position and the responsibilities you have don't allow that, there are other training opportunities. The Nashville Public Health Learning Collaborative, what we're doing today, is a training opportunity that allows you to think through those things, okay? So taking advantage of those things and talking about that, thinking really broadly about how you might help your path of moving forward. So this won't require a lot of conversation, but just one of the things to think through is, what path are you taking in your position? What are you doing professionally, and where do you want to be? What are some of the options? Again, it's not, we only have one director, so you don't have to aspire to work your way up the ladder towards that. But within your sort of your opportunities, what are the things that you can do, and what are the paths that you might want to take? And then what I want you to do is, having done that, so think a little bit about that. Now, we will take a couple minutes to think about, how does this path relate to your passion? Okay? And what we're going to do, we're going to take a minute and a second after we get through this slide, is to have you think about, what are 3 things you could possibly do over this next period of time to help move you forward in your area of passion. The first thing is going to be something you can do within 1 month. I'll leave the slide up here so you don't have to write it down. The second is going to be within 6 months, and the third is going to be within 12 months. Now, you might be having an acute case of passion disalignmentosis. The hallmark of that is sweating, shortness of breath. Have you seen the commercial for the stress BO that you put? I've never heard of that, but you might be developing a little stress BO. It's okay. That's what the reason you're here is to understand that this is a really long journey, and this is your career we're talking about. If you are in a position that has absolutely nothing to do with breastfeeding, and there's never an opportunity for you to ever talk about breastfeeding in your position, it is perfectly fine. We will have a solution for you. We may take that offline and talk about it, because we won't work through it all today, but that's okay. It gives you an opportunity to think broadly about that, and you can talk to people around you about what to do with that. So there can be adjustments that can be made. That's okay. It's perfectly fine. In fact, my hope is that there's at least one person who has passion disalignmentosis, because that will mean that you've had a chance to think about what you're doing and how you might make an adjustment in some way. Okay, so what I want you to do then is just to jot down briefly on your pad one thing that you can do within the next month, another thing that you can do within 6 months, and a third thing you can do within 12 months. Anyone else ever have challenges with, distractions, or actually focus on things related to your family or your children that made it kind of hard to sort of do other things related to your work? Anyone ever had that happen to them? Raise your hand. Raise your hand if you had that happen to you. Raise your hand if you felt guilty when you were at home and you felt guilty when you were at work. Anybody ever had that happen to them? Okay. So lots of people have had that same kind of experience, and there's nothing wrong with that. What you can do is say, you know what? I'm trying really hard. Maybe with my colleagues, I can talk to them about things around parenting. It sounds like if you care enough about your children that you're able to declare that, you're probably a pretty good mother, right? And so you could be, you think so, I can tell already. I'm a pediatrician, I'm an expert in this. So you can be a support person for other moms who are going through this. And when they're having breastfeeding problems, send them to our passion person up here, right? And say, have I got the woman for you? You got engorged and ba-boom, boom, we're gonna help you, right? So you're coming to work every day at the health department and having a job while you're doing a really critical thing for your kids. You can still do it in a way that makes a difference. It's not a disalignment. It may be slightly different than what you see yourself doing. That's fine. I bet there's a lot of people in here who've had either experienced that or are experiencing that right now. Nods and nods. Did you see all the nods? Good. I felt like I was in church. That was good. Let's hear it again. All right. Good. Thank you for sharing that. That's a hard thing to share when we're being all up high in the sky, isn't it? But that's okay, because what you're doing is really important. Who else? Anybody else having troubles coming up with 3 things? All right. So who's from our prevention? Is it a department, center, group? What's the title? Prevention and wellness. help me understand, for prevention and wellness, what are things that people can do to get a new health habit established?
We are about creating healthier environments.
Okay.
Through policy, systems, and environmental changes.
Okay. So changes in your environment, changes in your system. All right. When an individual's considering stopping smoking or starting an exercise program, what are things that they can do as an individual that will make it more likely that their habit will stick?
Contact our tobacco person.
And what will your tobacco person tell them to do?
Cessation classes.
Cessation classes, okay? So they are then making a public declaration of something they're doing, and they're reaching out and sort of saying, I want to stop smoking, right? So I want 1 to 2 brave individuals who are going to make a public declaration about the one thing they're going to do in the next month to help move themselves forward. And this will be your first step towards prevention and wellness of your healthy career. Anybody? Yes?
Get more training.
So
Facilitation training.
more training in facilitation? Excellent. Anybody else? Yes?
I'm already working my passion, my vision, and I work for the Fatherhood program, and for personal reasons it has meant a lot to me to be involved, and I've got 3 things that I think would help me be more involved.
Excellent. Great. To become more involved in the area that's her passion. That's great. Anyone else? Yes?
I'm going to become the expert on public health accreditation.
Okay. Great. So this person, and what's your timeline for that? That's a big...
Now.
So starting today, or starting by 11:08.
Starting yesterday.
You get. Well, okay. Now, great. So this is a really good opportunity. So this ambitious gentleman has declared that he's going to be the expert on public health accreditation. Well, are there ways how will we know he's done that? Okay, so the entire health department's accreditation is resting on your shoulders. I think you have undertaken a huge responsibility that might be out of the, beyond what you should be expected to do. But what's one thing you could specifically do to become an expert?
Read, research, and I'm networking with all the other accreditors across the nation.
Yes. Probably the most important thing you can do is talk to somebody who's done it in the last year. Find out who that is through either Dr. Kim's contacts or Dr. Paul's contacts or other contacts. Reach out to the person who had your sort of responsibilities and say, what were the 3 things you did that were really important? Now that's something you could do within the next month, right? So helping to break some of those really broadly stated goals into something really tangible that you will know. If I run into you when I'm coming in for a meeting with Dr. Kim in a month, I'll say, hey, how did it go in carrying the entire accreditation process on your shoulders? Or could I say, did you ever get a chance to find somebody in another health department that's done that? And you might say, gosh, you know what, I've been really busy. I'm raising 2 kids, I'm doing 20 other things, but I'd really like to get to that. It's fine. I won't judge you if I see you in the parking lot and you've not done it yet, but at least you're making some forward progress. So that's a way of thinking about how you might take that. Someone else had their hand up to share their goal or their thing that they're going to do? Yeah.
Well, I would like to develop and further develop my research and writing skills.
Okay. Great. And what group do you work with?
I'm with the Fatherhood program.
Okay, great. There's a lot of great people here at the Fatherhood program. So one of the things you might do is to say, in the next month, I'm going to talk to my supervisor about my interests in developing writing skills and get his or her advice on what I should do. Right? What I'll tell you is that my guess is that before you leave this room today, someone who's been there will come over and tell you. All right? And you don't have to raise your hand, but somebody who's ever had sort of saying, I want to work on my writing skills. How can I do that? Give this young person some advice on how he might pursue that, and then he can talk to supervisors. There's a lot of ways you can do that. That's great. But your one activity is, I'm going to find out what it is. That's all you need to do. I mean, that will be one step forward towards doing that. All right? Other thoughts or observations about this? This practice is really critical because it gives you a chance to articulate something you're going to do to move forward. Talking about it's really important. Setting goals and having passions is really helpful. But it's also really useful to say, what's one thing I might do that I can do in my job currently. All right? Okay? Excellent. Really great conversations. I can't tell you how much I appreciate what you all are bringing to the table in terms of sort of how you're working through this today. So now here's your homework. I actually defined your homework for you already. Sort of describe your path. To support my passion for fatherhood, I see myself helping to bring new programs and new grant support to the department so we can expand our current fatherhood efforts to new immigrant families, blank group, or whatever that is. So here's 3 things, boss, that I'm thinking of doing in the next year. 1, 2, and 3. Does this make sense? Am I doing what I need to do to be on this path? If I want to be a better grant writer, if I want to be the expert on accreditation, if I want to make a difference for fatherhood, if I want to help distressed mothers who are having difficulties with breastfeeding, are these 3 things going to move me forward, in your opinion? What skills should I pursue to help me? All right? Does everyone at the health department have an annual review every year? How cool would it be if in your annual review you could have this conversation? There's some check boxes, there has to be some things that are done, but if you can, in the goal setting portion, if you can say, you know, I love my job, and I feel like that I can really make more of a difference for fatherhood or breastfeeding or STD prevention or wellness if I could do this. And then within the scope of your job and the scope of your opportunities, your boss can help you say, yeah, you're doing the things you need to be on this path, or here's some skills you might get. And they don't require a major life overhaul. You don't have to move to Cleveland to do these things, right? Here's some things you might do. Questions about that? Does that seem like a likely scenario? Does anyone in this room think you're going to add a small section to your conversation on your annual review with your boss? Help me with a reality check here. Is that a realistic thing, or is that just like, you are an idiot, you have no idea how health departments work, you academic loser? Yes?
So to play devil's advocate.
All right, we got some devil's advocate coming here. Tell me about that.
What if you run up against a barrier and you're unable to get the additional training you might need, or your passion is in this area, you want to add in some additional things in the workload but unable to do so? How would you recommend to still find that passion and help in other areas? Would it be like off the clock kind of stuff, or what would you recommend?
All right, so if it's skills development and it can't be incorporated in, it might need to be something off the clock. It might need to be something you do on weekends or nights or online courses or those kind of things. And that's certainly an option for you. It might be that the answer is maybe not now, but later. I've got a case coming up that will illustrate that point. So you might say what you might be doing is planting a seed, and then your supervisor knows, oh, this guy's really into wanting to write grants. And his perspective will be really critical for this next grant rewrite. Okay? So that's the second thing. What's a third suggestion? So you come up with all these great ideas. You've got your 3 things, and your boss says, really enjoyed talking with you today. There's no way any of this is happening. We're in a resource-constrained environment. Who likes that word right now? Resource-constrained environment. So what do? What's the third thing you do? You can do it on your own time. Now, if you've got 2 kids and you don't have more time, it might not be that you're going to do it this year. Okay? You could plant the seed and be watching for opportunities that come up. What else could you do? What's a third thing that you might do if you hit a barrier to this? Anybody? Dr. Kim, you seem to be pensive there.
I'm just thinking. I mean, there's also the opportunity, it will still be in your own time, but finding a couple other people that have the same interest in doing it together, almost as either a study group or...
Oh, yeah. So like, let's say that the grant writing thing, the time-wise doesn't work out for you, but you do get a lunch hour, or 30 minutes, or whatever that is, or you have some time beginning of the day and the end of the day. If there's 3 other people that want to do that, find somebody who has experience with that and help them work together towards doing that. And what would be really great is if you can use it towards a product that will help your division. Like, the case study we had, a special report. So a special report on fatherhood issues in new immigrants from Burma, right? We have a lot of new immigrants from Burma in our community, and there's some very particular issues that face those families. And so you might help develop a report with your writing group where you say, okay, let's get together and do that. And it might not be that you can do a ton of time on it, but 15 minutes a week, whatever you can do towards it is a great idea. So Dr. Kim, that's a great idea. Any other good suggestions? Yeah.
Sometimes your supervisor may not recognize the skill set that you have in providing that opportunity. And I just know from my previous experience personally that I focus on the job that's at hand and doing this in the job there may be someone else that recognizes the work that I do and provide an opportunity.
Okay, so one path that is described is, even if it's not the skills that you're thinking you might want to do and the path you might want to go aren't immediately available, do your job so well that they can't possibly ignore you. You are such an effective employee. They described for me when we were planning this session, one of the clerks in one of the clinic areas found that getting the computer systems to talk to each other and getting things to work wasn't working so well. So she developed a one-sheet module for how to train people to do that. It was a small thing, but now she trains everyone that comes to work at that section on how to do that. Do you know who heard us talking about that? Dr. Paul. So the director of the health department knows that there's an employee here who cared so much about helping other people do that she developed a training module. It wasn't a part of her job description. It wasn't additional training she did. But now the director knows that there's somebody that has that passion, and people notice. So that's a great suggestion. Do a really good job. All right? So we talked about your passion. We talked about the path you might take to get there. Now what you want to do is think about, okay, if I've got a path lined up, I want to become the expert in accreditation, or I want to write grants, or I want to make major contributions to fatherhood or STD prevention or wellness. What are the specific things that you can do in your career? What are the specific contributions that you can make? So ideally, your contributions would align with your passion. They would also align with your path to help you move forward what that looks like. They should be strategic. They should draw on your best opportunity. You may have 3 or 4 types of contributions you can make, but if your current job and situation, or you've got family situations that prevent you may have aging parents that you have to tend to. It may not work for you to go take 2 years off and get an MPH, right? But you can do other things. So you want to be strategic to draw on those opportunities that are available to you. And they should also align with opportunities in your position, okay? So here's what we're talking about with planting seeds. There was a program coordinator who presented the supervisor with an idea to make improvements to services that were delivered by that group here at the health department. The supervisor said, that is a great idea. I love that. But in a resource-constrained environment, we can't really put that in place right now. But I hear you, and I really think that's important. Later, the health department, through the supervisor and others, identified a community partnership that would provide resources so that improvement could be put in place. And that program coordinator was able to incorporate parts of that new project into the ongoing duties. So planting that seed and that idea didn't pay off immediately, but it was a specific contribution. And by having identified the idea originally, the supervisor was able to help incorporate that into the person's duties. So what can you do? What on earth could you possibly do? What are the types of contributions? We've already talked about our Facebook, Instagram experts, right? Our Twitter experts who can help us think about how do we communicate across that. You might have people skills. You might be really engaging when you walk down the hall, or when you are out in the community, or you're at the community health centers, or you're doing a home visit. You might have some people skills where you can, even just connecting clients and programs and staff might be a skill that you've got. You might have language skills. You might speak another language that will be really important. That might be, you might be really good at engaging people. So you've got skills in engaging people, or accreditation person, because I noticed that when your table was talking about some things, you were really able to say, okay, I see what you're saying. Here's some things you might try. That's a really important skill. Didn't you guys feel engaged when he was helping you think through that? So that's a skill, and that's where your supervisors or people around you can say, yeah, you're pretty good at this. This is something you might think about doing. You might be really good at survey development. You might be, the Survey Monkey prince in your group. You might have done things out in the community for your church, or for your community group, or your sorority, or for your fraternity, or your service organization, where you've done some things that might be of value to the health department, right? You might be a budding artist. We have in one of our research groups that I work with, one of the respiratory therapists in our cystic fibrosis clinic is also an artist. So when they needed some patient education materials that showed airways, they were able to hire him offline through sort of a part-time job to help draw the pictures for these educational materials. Well, they had no idea he was a graphic artist until they were talking about it one day. So you have skills that may be really important that you don't think are all that skills. My sister, who is a speech pathologist and now stays home with her kids, has become an expert at running children's consignment sales. So she runs these children's consignment sales for her church with they make $150,000 every 6 months that they give towards mission projects. So she runs a small business. She set up a website. She started using market scanning stuff. She started figuring out how to organize things, how to have the high quality stuff, just through her innate skills of organization. Well, she just recently sold a business of running consignment sales where she'd run her own sort of on the side. And so she brought some of those skills. If you can do stuff like that, like organizing really big events, if you can throw really good parties and people always want to come to your house for parties, Dr. Kim could sure use you on the incredible, fantastic, outlandish baby shower, right? We need help with that. So come volunteer for that. I know you all have to volunteer for the disaster exercises, but be the best bleeding wound person or the person with the worst anthrax cough ever when you show up for the window, right? If you are an actor or an actress. You might have web skills. We had people in our case studies that had really good skills at developing websites or using Outlook or some other Microsoft or some other computer product really, really well that helped their group improve their workflow. You might be grant writing. You might be really good at knitting. Well, heck, knit us some baby hats so we can give those out at the baby shower, right? You might be a good cross-stitcher. You might be good, whatever you do, think about how on earth that could possibly help some mission of the health department. What's the mission of the health department? Okay, someone bravely tell us what the mission of the health department is. And I will give you a hint. And that I will shame you into telling you that the bricklayer I ran into knew it.
Protect and improve the health and well-being of all people in metropolitan Nashville.
Yes, that is the mission. Every day when you come to work, that's what you and your colleagues are doing, right? Next time I come back, I want to ask, what's the mission of the health department? And I want my hair, I don't have any hair left, but if I had hair, it would be blown back with each of you shouting out your mission and how what you do supports that mission, right? We're here to promote the health and well-being of every single person, all people in metropolitan Nashville, right? So when you help that person to the birth certificate office, or you take a parking spot that's a little further away so the woman can come to her prenatal class, those things make a difference. So how can you use them? Connecting people to services. Let people on your team know your skills. Volunteer to serve on new programs. Do your job with excellence. And take initiative to solve a problem. If there's a problem in your group, help figure out how you might fix it. So, in thinking through your activities, it's useful to sort of think about your career often in a 3 to 5 year time frame. Much longer than that, environments, families, life changes a lot. And it's hard to know, I can't tell you what I'm going to be doing in 6 years. But I can tell you generally how I'm viewing my career over the next 5 years. And I still do this. I'm always evolving what I see out, the contributions I want to make professionally, and how I'm going to move that forward, how it's going to help me make a difference. Okay? So, when you're thinking about your trajectory, think about role models. Who is someone in the health department, in your prior educational experiences, in those things that led you to your passion, that you want to be like? After listening today, I kind of want to be like Dr. Paul. He's doing some cool things, and he really is clearly driven by this passion. I learned a lot just hearing the story. Anybody learn anything new about Dr. Paul that you didn't know before? It's pretty cool that you have your leader have such a passion for that and comes to work every day to want to make a difference, to improve the health and well-being of all people in metropolitan Nashville. So, use your resources. What are those resources? Your supervisor, training opportunities, other things. And when you come to work every day, you can do things. So, review your passion and path. This is your skills building for home. Align that with your contributions. Pick the one that seems most exciting to you. Set some goals, like we talked about, 1 in 1 month, the second in 6 months, the third in 12 months. Include it in your annual review. Your second set of skills building is to take advantage of every training opportunity you can that will help move you forward. You cannot have too much training. You cannot have too much education. I love school. I'd love to go back and get a PhD in epidemiology. My wife won't let me. Actually, she would let me. She's very supportive. But my other life responsibilities won't let me. Come to our seminars. We're going to be talking over the next year through the lens of inclusion and health equity about how you can make a difference in public health, and how the contributions that you can make will help you in your position and all of us together make a difference. Come back. This has been really fun today. I'd love to hang out with you all some more. There's a whole, as a part of the accreditation process, there's a whole group working on workforce development and additional training opportunities. Links you, leadership development. Think about other courses you might take, other degrees you might pursue. Okay, so when we started today, we talked about thinking about an example of a role model for us that had a particular passion, path, and contributions. We added to that several examples, and we also talked about, for each of you, what was your passion, what was a path you might take, and what are some of the specific, concrete contributions you can make. What questions or observations do you have for us?
We talked a lot about passion and what we wanted to work for the contributions that we could make. But we haven't really talked anything about the environment in which you do that. And I just wonder, when you're planning your career, you're not just planning for your passion, but you're also planning for your personality and how to fulfill yourself as a whole person.
Mm-hmm.
Do you have any steps for how you can start to think about your career kind of in those terms?
So if I understand the question correctly, you're saying that you've got this innate passion and the things you want to do, but you also have other things about your personality type and your skills and the environment that you work in. If you work in a library and you are very loud and gregarious and tell jokes and laugh all the time, that is a personality type and a characteristic that might not fit so well in that work environment. Is that what you're saying? Right. That's where using reflection can be really helpful. So talking to people that you work with and talking with your supervisor and saying, what do you see in me? Here's what I see myself doing. People tend to gravitate towards the things that fit for them. There can sometimes be kind of a disalignment there, or misalignment there, but it's usually, you'll kind of end up in the right place. You'll end up pretty close. And you can use that reflection. If you're not comfortable talking to your supervisor, one of your goals should be making yourself comfortable talking to your supervisor, right? So sometimes the thought of talking to a person who has influence over your career, about your career, can be really scary and daunting. Well, their job, when they come to work every day, is to help you do that. That's what they're paid to do. So and so what you can do is say, my goal is to get courage or get a scripted conversation, right? So find someone that can help you do that. My mentor, when I first started my career, who I just had lunch with yesterday, would give me the perfect phrase for difficult conversations I was going to have. When I went to look for my first job, he said, if they tell you a money number, don't reply, just look at them. So that was his advice. So he scripted me through that. And the guy said, well, we'd like you to come here, be assistant professor, and here's what your salary would be. I didn't smile. I didn't laugh. He added $10,000 to that number on the spot because all I did was pause at the advice of my mentor. So people around you can be pretty good advice. I don't think they give you a $10,000 raise, but you're probably worth it. But anyway, so the point is that this person helped guide me through the really specific parts of the conversation because I didn't have the skills already to do that. I was intimidated by the conversation. And so I asked his advice on exactly how to play that out. Like, even so much as how do you sit? Where do you sit? How do you engage in that conversation? There are people here who can help you with that. Other questions or observations? All right. On behalf of the health department folks who deal with this, Dr. Kim and Celia and Dr. Paul and the 3 institutions, this has been really, for me, one of our most fun sessions. It's been really great to have your participation and engagement, and I hope that some of you will identify something that you might do so when you come to work, what you're doing is protecting the health and well-being of everybody in our city. Thanks.
Well, that I think is a very good conclusion to what we've done today. We want to thank you very much for coming, and this is one of several sessions that this group will have. What my job is now is to remind you to sign in, the sign-in sheet at the back, and then you'll be informed about our next session. So again, thank you very much for coming, and we'll see you then. Okay. No.